let you know that we are recording this meeting. So this is our objective for the day, right? So by the end of this meeting today, this is what we hope to do. We're going to ground our nervous systems and practice some resiliency tools, hence why I'm here and happy to be a part. We're going to learn about data tools that we can use to measure things and better work our programs. We're going to hold virtual space to connect with each other, right? Because we know that's so meaningful. And then we're going to learn about ROI's data dashboard. So this is our agenda. I've already welcomed you into the space, and that's wonderful. We have a guest speaker. I'll get to her right after we do a rapid reset. So what I want to remind you guys as we're coming into this space, right? We want to be present. We want to be in the moment. And we know that sometimes when we have a jolt to the system, it can knock us out of that connect zone. We want to be in that connect zone, that resilient zone, so we can collaborate, learn, share, be creative, and connect with each other. But sometimes we know that there's things that stop us from doing that, and we can get stuck in that amped up zone, right? Or we can get stuck in that shut down zone. What's so important here I want to share with you this morning as we're going to reset our nervous systems to be present is that sometimes that threat or trigger can be a minor stressor as well, right? It could be a disappointment on yesterday. It could be something you're worried about for tomorrow. It could be some meeting you have this afternoon that you might be nervous about, right? So it doesn't have to be trauma, right? It can be anything that can knock us out of our resilient and calm zone. So we want to make sure we're present and in the moment so we can have the best meeting we can have. We can show up our best selves. So we're going to do a rapid reset right here to bring us into the room, right? So I'm going to invite everyone to join me in this rapid reset. This rapid reset is called Orient. So I want everyone to bring their awareness to the room or the space in which they sit at this moment. So I want you to look around the room from ceiling, walls, down to the floor, all the way around in every direction, especially behind you. You can focus on a color. You can focus on anything meaningful, maybe family photos, maybe mementos you've gathered or you've collected from travel. It could be books, anything that means anything to you that catches your eye. Just really give your focus. And as you look around the room from top to bottom, notice the windows, notice the doors, right? Because what we're signaling to ourselves is that we are safe. We are safe in our space. There's no danger here. There are exits. We know where they are. If we had to leave, we could. We're signaling that to our survival brains. So our survival brain can be soothed so we can be calm and have our thinking brains on so we can be present in this moment and have a wonderful meeting. So I invite all of you to just do that. Just a few more seconds, just really give your attention. And then I want you to notice, I want you to sense in, and you don't have to share with me, I'm going to share with you, but notice the change, any change that you've had in your body. I noticed that I took a deep breath, right? I noticed that my shoulders kind of relaxed because I was a little nervous, right? A little tense about emceeing this meeting, right? So I didn't even notice that I was a little tense. Had some tension in my shoulders. I felt that relax as I took that deep breath, as I brought myself into this moment, into this meeting with you guys. So I hope you found a relax, release, and a reset. And now we're here and we're ready to press forward. So next up is our keynote speaker, Melissa McCoy. And Melissa is a data and management, let me get it right. She is a data and change management consultant. And as you can see from her bio that Seth is going to put up for a second, or I'm going to read it just to give you some background. She has a wealth of experience in helping communities use their real-time data, right, to drive continuous change in their organizations and communities.
You got it.
And her main focus, thank you, Melissa, her main focus right now, or one of her passions, is to dispel the myth that we need expensive data systems and full-time expert analysts to drive this data to meaningful change. So she's here with us today to share some valuable information and perhaps some tools on how we can use our real-time data to drive meaningful change and continuous improvements in our community. So without further ado, I'm going to turn it over. I'm going to welcome first and then turn it over to Melissa. Melissa, welcome.
Chandra, thank you so much. I'm listening to you, MC, going, I just couldn't do that. I would be, messing everything up. But so thank you for that. And thank you all for being here. Thank you, ROI, for thinking that what I have to share is interesting enough to put me in front of your community and your partners. The more that I've gotten some insight into the work that ROI is doing and that you all are leading in Edgecombe County, the more I'm excited to be a part of it, even if it's in a small little way. So thank you all. I got to share my slides. Oh, the joy of Zoom. Okay. But I don't have a share button. So I'm thinking I might not be host yet. So I'm going to stall a little bit. So I think that part of the reason that Vici and Seth asked me to, but I have different slides than the ones I sent.
Try it now. Does it work?
I just don't have the share. Oh, there it is. Yes. Sorry, my bad.
No worries. We just changed it.
Okay. All right. And I didn't have it ready. Okay. So part of the reason that I think that they asked me to share today is because I'm not the data person that's coming to, I'm not a stats person. I'm not your regression analysis person. I'm somebody who has kind of been on this journey with data and continuous improvement for not too long, really since about 2013. And in that time, I have learned a lot. I've seen data and improvement tools used in a bunch of different contexts, most of which are in the education and social sectors. And so, I've seen what resonates with people, what works, what sticks. And I think the biggest thing I've learned and what I hope you take away from today is that data is not as complicated or confusing as the data wonks or kind of big consulting firms have made it out to be. So what I wanted to start with today to kind of get us grounded and give us a lens for what I'll share today are these two quotes. And so I wanted you to, all of us, to take a look at these two quotes, which might seem a little bit out of place on the same slide or in tension with one another. But I wanted you to just take a minute and process them and think about how these two ideas, quotes, how they're in tension or how they might even complement one another. So I'm going to give us a few seconds to take it in and kind of think about that prompt. And then I'm going to hopefully ask at least one or two people to share their reaction. And I'm going to be hoping that folks share because I'm awkward enough as it is. I do not need to have to fill an awkward silence. So.
Melissa, are you sharing your slides?
I was trying to.
I know, I'm just checking because we don't see them yet.
Okay.
It's coming through.
Sorry, guys. There we go. These
No
are the quotes that I thought I had up the whole time I was talking.
You're totally good.
All right. Have we had enough time to process that? And is there anyone that wants to share how they think about these two ideas together? Or are you going to make me fumble and be awkward? I'll do it.
I'm Yolanda. I am one of those people that I'm looking at both of the quotes together and trying to decide how they would correlate. I do 100% agree with the top quote, but not understanding how they work together.
Fair. Yes. Anybody else?
Well, I'm looking at it as well. So from what I get from the top part is that I don't have to go on my opinion if I have data in front of me, but if I'm working with an organization, I'm figuring that's my comfort zone. So whatever they say, whatever they're going with, that's what I'm comfortable with. I will roll with that to take my opinion out of it. So that's my superpower as well. I would say something like that.
Yeah. And I think that's kind of was my line of thinking, or when I was kind of thinking about how to make this point. For me, I always start with the data. I think the data is going to tell us where to go, but data isn't always numbers and quantitative measures, right? Like sometimes some of the most important data that we have or can get is qualitative data. It's data that we or information from our experiences, from our interactions with others. It's it's the insight into how something is working or affecting people. And so I just wanted to kind of start us off with that kind of frame of thinking about data being critical to really driving change and figuring out which direction to go, but also thinking about data more broadly and not prioritizing one over the other, because that qualitative data is often more important than the numbers and that kind of outcome data. And so I thought I mentioned that I've kind of only been on this continuous improvement data journey since about 2013. And that is when I made a pretty abrupt career shift. And I found myself at an organization called Strive Partnership in Cincinnati, Ohio. And it's a community-based, education-focused organization trying to improve outcomes, cradle to career. And here we are. This is a picture I found from Halloween where our team was dressed up as the cradle to career education continuum. I guess because that's what our work focused on, and we were not super creative. So besides seeing some awkward folks that I adore in awkward costumes and a time when I used to straighten my hair, I see a Melissa here that knew nothing about continuous improvement. I started there thinking I was going to be working more on like advocacy work. And our executive director asked me to take the lead on our continuous improvement and data training. I had to go back to my desk and Google what continuous improvement was. Had no idea. But after the Googling and after agreeing to kind of take this on, I started learning, and we had the opportunity to learn with the folks at Cincinnati Children's Hospital. I'm not sure if anyone's heard of Cincinnati Children's, but it's pretty prominent around the country. Folks come from all over because they went from being pretty much a mediocre children's hospital in the Midwest in the late 90s to now being one of the most preeminent year over year top children's hospitals in the world. And they attribute that to what they call their pursuit of perfection, where they got really serious about continuous improvement and applying this science to healthcare. So continuous improvement is something that has been used in manufacturing since like the 50s, then healthcare jumps on board in the 80s and 90s. And I would say kind of education and social sector much more recently in the last 5 to 10 years. So we get trained up by them, learning. We build out a professional development course called Impact You. becomes a kind of training hub for nonprofit leaders and frontline folks in our community. And it's great. And we're spreading it. Our funders are starting to think differently. But as I'm going around, I'm networking around the country. We're, part of different networks and sharing what we're doing, trying to learn from others. I'm trying to research who is doing this, who else can we learn from? And I realized that there's a real gap. And nobody's really doing what we were doing. And if they were really making it a lot more complicated than it needed to be. And it wasn't taking root because of that. So I kind of realized, I want to be a part of spreading this to other communities, to, help those that are closest to change and changing results make a greater impact. And so, here I am. I've been in 2018 started my own consulting company, and I've, had the opportunity to work with, communities around the country to make this apply, make this kind of thinking and tools and methods work, and folks be able to see their work and their clients in this. So it's just a little bit of a background. And I, before we get to some of the data tools, I kind of wanted to use this time to kind of share a few of the things that I have learned along the way. And so the biggest one, and this is kind of the main point that I wanted to make today, but the biggest thing is that you do not need big data or a fancy analyst to inform or initiate transformative change. I think that's the biggest thing I've learned. And when we started at Stripe Partnership, we had these giant data warehouses that brought together, out of school partner data with the education academic data, and we'd put out this report card on all of our outcomes. We disaggregated it by race and gender, thought we were killing it on the data front. And I really do think that as a community and everybody behind kind of all this data approach, we really thought like this huge, these big analyses were what was going to help us identify best practices, fix every problem in education, and ultimately, end the generational cycle of poverty. And what I realized is that's not how it works. And, how change actually happens is on a smaller scale, and using data day to day to improve what you do and how you provide your service to folks. And so, if you simply spend the time to select a change process, whether it be continuous improvement like I've talked about, or there's design thinking, results-based accountability, you may have heard some of these, the list goes on. But if you have a change process alongside a solid goal, and you build a comprehensive kind of theory of change or hypothesis about how we're going to get there, I really think that you will realize two things. One is that you only need to measure a handful of things, like I mentioned, those things that measure how well you're doing your job and your programs are being provided. And two, the data that you need will be about how well you're providing that service, not lagging, retrospective outcome data, which is what we are often focused on in nonprofit world. Let me check my time, because I have, another story that I think about a lot is we would put out this report card, and we had a partner. He was the director of the housing authority. And we're all proud of this report card that's had all this time, money, and effort put into it. And he raises his hand and he goes, so this is like basically kind of like an autopsy, right? And we were just like all kind of taken aback. And he went on and he said, this doesn't tell us how to help the third graders that are struggling to read right now, or the high school juniors and seniors that are struggling to graduate. It tells us how poorly, the last cohort of kids did. So it's basically just an autopsy, right? So let that sink in. And he wasn't wrong. He was spot on. And the difference is shifting your focus from outcome measures to process measures. You've still got to measure the outcomes. That's what funders are always going to want. And you got to know the outcomes, right? But your outcome measures should be connected to a theory around this is the stuff we're doing day to day that we can be measuring to know what we're doing today and how, if we're doing it better the next day. So that's a big one. And the second one is kind of related to that quote that seemed out of place on that first slide. Early on in my journey, 3 of my mentors, 2 from Cincinnati Children's Hospital and 1 from a school district in Menominee Falls, Wisconsin, they all advised me and really kind of pushed us to stop thinking that nonprofits and education were any different than, say, healthcare or manufacturing in terms of implementing these types of tools and methods and thinking. And one of them used to say, you are not terminally unique. It is called science for a reason. Continuous improvement science is called science for a reason. And I held that pretty tightly for a while. I believed it, but over and over again, a couple of things started to stick out. And one difference that seemed important was that in healthcare, you are performing the same procedure every day, but on a different patient. And in education, for example, we have the inverse. We have the same patient or student, but we're performing different procedures. If you're running a program, you might have the same set of clients that you're working with, but you're working with them on a different procedure or thing every day. And so it matters what they're experiencing. It matters what context they're in. You have to know all that. And the second thing is that in medicine and in manufacturing, they have standards of care. There is a list of, here's how you wash your hands. I mean, there's like diagrams that will tell you the 9-step process to wash your hands. We don't have that for how you teach algebra to, an 8th grader that didn't get to eat breakfast that morning. So it is different. And I ultimately kind of changed my view a little bit. And now I believe that this work, your work, the work that you all are doing is unique. And the context for your work is unique and it is critical. Sometimes we need more tools in our toolbox. We need to better understand a problem before we try to solve it. So, this is kind of a like, trust your gut. And also, you are the expert of your community. You are the expert of your work, or who the experts are, who is experiencing a particular thing and who can help you better understand it. And so I think my biggest thing I just wanted you to take away here is the experts aren't always the folks that you're, paying to come in and help you solve a problem. Often the expertise lies right in front of you. And then the next thing is kind of, this is more of like a PSA kind of, as you're, if there's directors or folks out there that are bringing people in to help you with data specifically or improvement, if they are a real expert, they can meet you where you are. They should be interested in and want to see any work that you have completed, see how far along you are in, any particular kind of like problem solving process. If they are shoving their stuff down your throat and aren't interested in what is already exists or in place, I think that's a big red flag. So I'm looking at time and I've got to pick it up here a little bit. So I wanted to pause because I've been talking now for 15 minutes and see if there are any questions or if any of that resonated with anyone or didn't resonate.
I'm gonna jump in. And I know I said I just got my second COVID vaccination and I look like, but My and Melissa, I completely agree with what you've said. My background is medical, and I just want to, because you brushed on this, but in this age of vaccinations and testing, and I just want to kind of reiterate that when we talk about medical and medically related scientific research, we're looking at completely different things, right? The big data matters. Don't come to me with a study that involved 150 people, right? The medical pieces, you can guide future research off of that, but you cannot make medical best practice advice unless you have big numbers, placebo controlled, double blinded medical kinds of research. So I totally hear where you're at, but I don't know, I felt like I needed to say, especially because I'm seeing so many articles about, people posting that, 145 people that, didn't get the vaccine. And I just need to say, understand that when you're talking about medical research, it's a different animal. Does that make sense?
It does. And that's not our world though, right? That's not our world. We're never going to have that kind of data or research. There's never going to be that kind of money behind it. And frankly, it's often things that you can't, it's so multivariable, the problems that you all are working on, that you're never going to have those types of studies. And so oftentimes, and the thing I say a lot is, there's some work you have to do to find the right measures, your day-to-day efficacy, how well am I doing the thing? But sometimes you just it's just good enough, right? You got to get to something that's just good enough to get started and give you a sense of, is it getting better from the day before? It doesn't have to be in our world to make change and to move forward. It doesn't have to be to the level of statistical reliability that clinical studies have to be, but you do got to get something and you got to get started, and you need to know with some level of confidence that what you have is giving you enough information to make a decision about whether you should keep doing it, change it, or abandon it, right? Anybody else before I move on?
Well, no, just kind of going on what you were saying, tying what you were both saying kind of in together, where she was saying, yes, as far as medically, you would need those big numbers in order to have anything conclusive, but kind of tying back to your statement as far as maybe some of those small numbers are what can help at least to initiate that process. We're tying back into kind of what you were saying.
Yeah. Thanks, Kelly. Or was that? Yes, I think that was Kelly. Okay, so as promised, a couple of data tools that hopefully you all can, see how they could apply to your work. And the first one, Kelly kind of teed it up pretty nicely because it is about kind of figuring out where to start and kind of using some small numbers, some sample sizes to give you enough information that is good enough to get started. And so this one is called a Pareto chart, named after an Italian guy named Vilfredo Pareto. Useless Jeopardy fact that I just mentioned because rhyming names are kind of interesting. And so you may have heard of the 80-20 rule, and he basically came up with that. And it's the idea, the rule that, and this is an observable phenomenon that has been observed in many, many contexts, kind of throughout society: wealth distribution, land ownership, even just kind of like strategies for improving things. And so the idea is that 20% of your effort, just 20% of your effort, can actually get you 80% of your results. Not always, but it's like just good enough. And so this is a chart that can be used to figure out, okay, so if we have a bunch of different things we want to try, strategies or interventions that we've come up with that we want to try. So let's put those in a list, and then let's go observe our process or talk to some folks to ask them, what are the challenges that, what are the reasons that the thing that we want to happen isn't happening? What are the challenges or barriers? And you're literally like, you've got a piece of paper and you've got your categories or your buckets of things. So on this example, these were teachers that were trying to get the rest of their colleagues to implement these kind of rapid cycle testing cycles. And so it wasn't happening and they wanted to figure out why. They figured it was that the teachers didn't have enough time because they were lesson planning and they were just completely stretched. But when they went and I think they had a piece of paper they put in everybody's mailbox at the school and asked them to check how many times each of these occurred. And in 1 week, they gathered this much data, and this is how many times these things occurred. And what they learned was actually, it wasn't that they didn't have time. It was that the teachers didn't really understand the standards and what exactly they were supposed to be teaching. But not what they were supposed to be teaching, but how the students were supposed to demonstrate that and whether they had achieved it or not. But when they dumped it into this Pareto chart, you can see that they realized that they needed to focus on the first two, the standards breakdown and unsure of what to do with data from the previous cycle, because those two get them to 81.8%. So the theory is that 20% of their effort targeted at those two things will get them an 80% jump, right? Here is another example. The Fawcett House is an emergency shelter, and they were really struggling with their data collection. The integrity of the data was really compromised, and the data manager was trying to clean it up and figure out where the biggest problems were. So she went back and she looked at all of the missing data and where there were holes. And so each data point represents a missing item. And what she saw was that to get to 80%, if you kind of follow that bar all the way across, that 26 in the admission category gets her well above 85%. So she really realized that she only needed to initially focus on the admissions. And so then the second, the black chart down there are the items within the admission form that were missing. So she drilled down and did another Pareto, and she found that the youth personal property inventory was the biggest gap there. So has anyone used a tool like this or a chart like this to kind of get started or kind of figure out where the biggest gaps are? Is this familiar to anyone? Can you see it applying to your work? Can you see this as something that would be helpful?
I don't know if you can see it, Melissa. I did want to lift up in the chat that someone said, this really shifts my perspective. I've always looked at it in a way that 20% of the people do the work and 80% of people aren't doing enough. I never thought of it that 80% of your work can be done with 20% of your effort. That means we can get a lot of work done with base effort and input.
Yeah.
So I think it's definitely resonating in that way.
Yeah, and I mean, I think the other time that I pull this tool out is, I mean, how often do we sit around like a brainstorming or an ideation session and there's tons of ideas, and maybe like there's like this group over here that wants to run with this idea, there's another group over here that wants to run with this, or we feel maybe there's an emotional investment in a going a particular way. And what this does is say, these are all great ideas. Let's go see what the data is telling us. Let's go, let's put those into categories and let's go take a sample. However much our gut tells us we need to get a good enough sense of what the problems really are, what the gaps are. And then let the data tell you where to go. It kind of takes the emotion out of it and it makes it a data-driven decision. And so with that, there's one more tool. How am I doing on time? Okay, about 5 more minutes. Is that right, Vici? Okay. I kind of mentioned this before. There's one more tool that, you know, it really, to me, is this simple chart that tells you day to day or week to week how well you're doing. And if you have that, you don't really need anything else. I mean, you know, you can build on that. And obviously there's, you know, more that we could always do. But I feel like these data folks and these consulting firms have like pulled the wool over you know, the nonprofit world's eyes, and they've made us think that you have to have all of these fancy tools and that they're the only ones that can, you know, provide these statistical analyses. And the reality is you don't need it. You need a time chart that tells you how well you're doing over time, and you need to understand a few basic rules to tell you, you know, what that chart is telling you. But what we usually see in nonprofit is pre and post, right? And I get some thumbs up or head nods if we're used to seeing this is the explanation of the whole thing. Usually it's like, well, it started here and it went up, so it must be better. Did the intervention make difference? Well, clearly it did. I have these 2 bars and look at it, it's so much higher. But the problem is that by definition, change is temporal, meaning it happens over time. And this kind of chart does not give you the whole story of what has happened over time. And to kind of illustrate that, you know, if you look at your pre-intervention, you were at 12. So that's that first dot there. This could be an explanation for that pre and post intervention bar chart. You start at 10, but then you don't actually start your intervention until maybe like 10 weeks in, and it was already going up at a pretty steady pace. And then it keeps going up at about, you know, the same rate. So did your intervention make a difference? I mean, I would argue probably not. It was already maybe doing that. So you're going to keep doing this intervention that's likely, you know, time and effort intensive when maybe you don't even need to. Yet another explanation for that same bar chart could be this: that maybe there's just a lot of variation and things are going up and down continually, and they're going to keep going up and down after. So again, the main point is that if you're going to understand if something is working, you need to look at it over time. And so the second tool that I would love to share and spread all over the world is called a run chart. You'll hear it called a trend chart sometimes. And it's just a chart that takes your measure and measures it kind of apples to apples, week over week, and puts it on this chime chart. And you also are going to track your interventions. And there's a few simple rules that we can go into deeper if there's interest in doing some follow-up on how to use these charts. But basically, you've got your median or your baseline there at, like, let's say that's 62. That's where it started. You always want to know where you're going to start. And then when you have about 6 to 8 points above that median line, you will know, you can have a pizza party, you have statistically changed that process and there has been an improvement. And so you shift that line, and that's your new median. And you're watching that median line and you're watching your data points. And when you have 6 points above or below that line, that is when you move that line. And that means, you know, improvement or the opposite. And it's just really, it's not that complicated. So again, a strong measure, a way to track it and looking at it in real time. If you're not tracking something, at least I would say weekly is ideal, or bi-weekly, you're going to have to wait. Like I said, you need 6 to 8 points. So if you're tracking something bi-weekly or let's say monthly, you're going to have to wait 6 months to see if that's the soonest you could see if there's a change. So it's just this idea of real time and shifting from, oh, well, we only have this data that's quarterly or semi-annually or annually, to, but what can and should we be measuring on a weekly or even daily basis? And oftentimes it's, you can start out by, a blank piece of paper and just maybe some tally marks, or recording it like that and just dumping it into this sheet. Or even I've had folks just draw them on paper. If you don't have maybe somebody that's comfortable in Excel and figuring out medians and all that, it's not tough math, it's just plotting it and looking at the baseline and seeing where your line's moving. And so that concludes my bit for today. Is there any kind of questions or reactions to the last chart? If not, I will kick it back.
Melissa, thank you so much. And just for anyone on the call, if you're interested, Melissa's generously offered to do a follow-up. If you want to go deep with your organization or a program, she's happy to host an office hour call where anyone can join. It'll be an hour to an hour and a half, and she can go more in depth. Like, you could bring data or a problem and she can help you make either of these charts. So in the feedback survey, just make sure to say, I would like to do a follow-up office hours with Melissa, and we'll coordinate that and make sure that happens. But just a big thanks, Melissa.
Thank you all. Thank you for having me.
Okay, thanks again, Melissa. I think we were going to maybe go into some breakout groups to kind of share any ways we're currently using data, or any aha moments we might have had around anything Melissa shared, or ways in which we think now we could use data. So what we're doing now, or maybe what we can do, just share kind of your experience. Okay, so you're going to introduce yourself. You're going to share a resource, which is a person, place, or experience lately that helped you feel calm or at peace, right? Because we're everything is grounded in resiliency, right? And so we want to make sure we're here and we're connecting with each other. And once we do that, we're going to kind of discuss how our organization already uses data, and maybe how these tools or charts could help us improve what we do. We're going to be in our breakouts for about 10 minutes. Tyra is going to get those all set up for us. I think she's working on them. So when you're ready, Tyra, let me know. And then we're going to go into these breakouts for 10 minutes, and then we'll meet right back here in the big room.
All right, they're ready to go.
All right, there you go. Join your groups. Thank you.
It was a great opportunity, so thank you so much. Okay, so today we're going to share 3 things with you. The first, just a background on what this whole data dashboard data project is and how it came to be. Second, I'm going to turn it over where you all get to hear directly from 2 participants that participated in these workshops. And then lastly, if this intrigues you or interests you or resonates in any way, you're going to have the opportunity to use this tool. Okay, so this slide's a little bit confusing, but I'm going to walk us through it. So it offers a visual timeline on how this project has gotten to the point it is today. So as you all know, and as Vici just shared, RI has been doing this work for a long time, over 2 years, and it all starts with RI building that systems map, which many of you on this call participated in. It involved over 300 community members, and it led to creating that strategy for responding to trauma and ACEs in Edgecombe. This past summer, I had the opportunity to co-create a data dashboard. So that's a tool that we're going to be sharing. It's based on pieces of data that community members said were necessary for residents to thrive. And so these were love and support, trust in public institutions, safety and peace, and parent and family engagement. And then I had the opportunity to collaborate with some professors and a research team from UNC to figure out how to make that giant Excel document and narrow it down to the data that people really, really wanted to learn more about. And then now what we're going to be talking about today are 2 different workshops that we piloted. The first in January of 2021, where we did a mapping activity to help leaders dive deep into the patterns and the data they saw. Jennifer is going to be sharing about this shortly. And then in February, we piloted a second workshop where we took the patterns that we discovered in the first, looking at that big map that Beachy just explained, and figured out who needs to see this information and what they need to do with it to take action. All right, so in a moment, I'm going to pass the mic over to Jennifer. As I mentioned, this was the first workshop that we held, and the entire goal was just to get feedback. So we did it with a small group of people, and these are some things that we learned here on the screen. As we did today, it's really important to have connection and spend time in breakout rooms. It's also very important to note that data was desired to be not only historical over time, but data needs to be broken down by race. That was something that was really, really important to participants. People wanted to walk away with something at the end of the workshop to have tangible tools that they could use and share with family members and others at their organization. And data can be really intimidating, so it's important to have it in small doses and in a comfortable setting. So with that, I will turn it over to Jennifer.
Jennifer, you might be on mute.
Sorry, I like to keep myself muted. Good afternoon. As Gretchen mentioned, the purpose of the first workshop was to look at patterns behind the data regarding health in our community. There were several insights that we were looking at. The first one was that people are not spreadsheets. So when we look at a chart or a graph, that actually relates to people. So someone who's looking at just that chart or that graph and doesn't really live in the community may draw one conclusion, but actually it may be something else that's causing the actual problem. So we need to dig a little bit deeper. And so that's why it's so important for community members to be interviewed to help understand what is actually happening. Next slide, please. Okay. When we went to our breakout sessions, this is one of the activities that we did. So we started with looking at mentally unhealthy days in a month for residents of Edgecombe County. We were looking at the patterns that we saw and what was happening in the community that might counter what we actually saw. And then we were also asked to take those 3 bubbles that are at the bottom and place them where we expect the data to go. So the first one was the gray bubble, and we looked at where we expect it to go in 4 years. The red bubble is where we fear it's going to go, and the green bubble is where we would like for it to go. So we were looking at several different things when we were looking at this. And I know sometimes you look at it and it looked a little bit busy, but once we got to having a conversation, it made it a little easier for us to kind of dissect this graph. If you will go to the next slide, please. Great. Okay. So this is the final picture, and we had a lot to say that wouldn't fit on all those sticky notes that we were coming up with. But if you see at the top, we placed that red bubble or the pink bubble where we fear it would where it would go. And you can see that that was higher than what we would like, but that's what we fear when we start looking at some of the reasons, which I'll talk about in a second. So we feared it's going to be even more mentally unhealthy days per month. Then the next one is where we expect it to go, which is the gray one. I guess the green one in the middle. And it's still rising. It's increasing as you're looking at the dates at the bottom. It's increasing. And then where we hope it goes, we'd like for it to drop back down to the bottom. And that would be our goal. But without having the community-based context of things happening on the ground, these numbers don't make sense. When you just look at this and you don't look at our sticky notes or our comments, then someone from outside of our community may draw a different conclusion. A lot of our mentally unhealthy days are related to trauma, and it's not just a one-time trauma, it's repeated trauma. Our area has been affected by Hurricane Floyd, and then we were affected by Hurricane Matthew. And then of course, now we have COVID. So when a researcher's looking at this information, they don't know all that information. They may not know all of that information. And so they wouldn't dig as deep as we did within the community. They make sense to us because we live in the community that we that we're talking about here. Students were fearful and anxious when there was rain. Many of them had to move from one school to another. They were living in temporary housing for a long time. And then just about the time that they were starting to kind of recover, and I know that trauma continues from Floyd, then we ended up having another hurricane, which did almost basically repeated what they had just gone through. Anytime there was a chance of rain, people became very, very panicked and concerned. So we're looking at increased mentally unhealthy days. We also had a discussion about the need to support people with mental health resources after these repeated traumas, because even though the trauma, that actual event is not still happening, there is still trauma related to that, and they're still having mentally unhealthy days even long after that trauma has gone. And unfortunately, in our community, we don't have a lot of counseling. A lot of people use the emergency room, and so there's not a lot of some people just use the emergency room as a holding tank until they can find somewhere else to go. We also talked about reasons we think the number of mentally unhealthy days will go up, because we've got a lot of senior citizens right now who are being isolating just to protect themselves because of COVID. And so they've been at home for over a year, fearful of even going out into the community. And so that is another reason why we may even have more mentally unhealthy days. I think this was a really valuable workshop, and I felt like I got a lot out of it.
Great. Thank you, Jennifer. Okay, so now we're gonna switch gears to talk about the second workshop. So what Jennifer just shared is the first one. It was a lot to do in one time, but we did it. And then I'm gonna turn it over to Naeem to talk about the second workshop. And so as I mentioned, that's moving from understanding the story behind the data to action. And so the second workshop we held last February was connecting the story that individuals on the ground recognize with that larger systems map that Vici just explained. And so the final step of the workshop was coming up with potential solutions. And on this slide, here are just these three things that we learned. Continuously, connection matters. It's important to be in small, diverse teams. It's also important that everyone knows who's in the room and people have the opportunity to speak to one another. And because data can be so intense, it's important to have short sessions and breaks. So with that, I'm going to turn it over to Naeem.
Okay, good afternoon. This slide offers the key takeaways from the second workshop. First, as Jennifer said, unless community members that know what's going on are involved, we often focus on the wrong things. For example, although the data might be on improving graduation rates for students, it is important to involve and engage parents in that process. But the data doesn't tell you that. On a similar vein, if you don't work with the community, again, like Jennifer mentioned, then researchers or policymakers tend to identify wrong problems. And lastly, coming up with solutions must come from those communities. Next slide, please. Our team looked at specific data point of the percentage of ninth grade cohort graduates in 4 years. So basically, all students that completed high school in 4-year time frame in Edgecombe County. This fell under the larger umbrella of parent and family support. And this slide shows the pattern that the data showed. And like Jennifer mentioned, because we had a lot of similar thoughts. unless parents are actively involved with what the school, their children are doing, they're not going to buy into anything that's happening with the education of their children. Next slide, please. However, what I am excited to share with you today is our solutions that we brainstormed together. As I mentioned before, data doesn't tell us everything. We often mainly focus on students and teachers to increase graduation rates. However, we need to engage the parents more. That's one of my pet peeves. For example, if children are talking about the language of resilience that they learn in school, there is a potential for conflict between parent and student, and then student and school system, because parents don't have that same set of language. We're talking about producing podcasts where students will be hosting, and the guests of the podcast will be students, and they already know some of the language of trauma and resilience. But sometimes the parents will be disconnected if they don't understand what their students are talking about. And when they go home and they begin to talk this language with the parents are going to tell them, look, boy, look, girl, get out of my face with that school stuff. And it happens like that in our community. So this brings up a lot of times they do that because their parents are intimidated by school officials, teachers, administrators, because when they talk about the school system, this brings up sometimes their own bad school experience, and it creates a negative cycle for their children. And so for this reason, solutions that we came up with to increase graduation rates centered on educating parents on resilience, language, and tools. And this looks like sometimes things like passing out the Reconnect for Resilience cards after we've trained the parents in some of these methods. Also encouraging family meals and bringing up those words and terminology in with the parents and the children, as well as creating a parent panel where we directly educate parents on these skills. Because without knowing what's happening on the ground, the policymakers and the researchers would have most likely never come up with these kind of solutions. They would just throw numbers at you, numbers at you, numbers at you. But we put in the human element because we go to the community, get the community involved, get the parents involved, and then we'll have something to work with. That's why I'm so excited about the podcasts that are going to be produced by our good resilience educator, Byron, and the rest of our team. Without parent engagement, without community engagement, none of this is going to, none of it is going to fly. And the people in the education department, especially the counselors that work hand in hand with these families, can make that happen by engaging the parents. And I'm sure that ROI will make a brief training available to the parents so that they can get on board. I think my time is up. So that's it.
That was amazing.
Community involvement.
I agree, and that's perfect. And this is just our wrap-up slide to say just what Naeem and Jennifer just shared, that community voice and context is essential when looking at data. Breaking down the data by race was also very, very important, and that's kind of a call to action for community health assessments and any kind of other data that your organization might be collecting. We often focus on decreasing the bad instead of increasing the good. And so focusing on strengths that communities have are important. And then a leverage point would just be thinking about community health assessments or other surveys where we can ask about the good. All right, and then if this is interesting to you and you want to use this tool, so all of the tools that we use to put on these workshops is available to anyone that would like to use them. I'm going to put it in the chat, just a link to this Google Doc where you can access it. If you have any questions, we're happy to help with that as well.
Okay.
Thanks so much, Gretchen. So just going to share, that was a really insightful presentation, really enjoyed it. Thank you so much. Just going to share really quickly closing updates. So Naeem just mentioned it. There's been a year-long process happening with Edgecombe County Public Schools around interviewing families and building small prototypes or solutions. And one of the big ones is the podcast that's being produced by Byron Hall. There's also a project around decorating hallways with resilience tools and skills so that students and staff can be prompted to use those tools. There's a community-based coalition project that's been happening with a group of teachers to connect better the schools and the family environment, the home. And then the last one is a project around improving discipline communication when there are discipline events at school, because often that's connected to trauma. And then Tyra, do you want to share about Resilient Leaders Initiative?
Yeah, so as you all know, Resilient Leaders Initiative kicked off last month. And so far it's so good. And we're just really excited to announce the very first teams of the cohort. Yeah, this is just a very exciting time for us. So the teams are Word Tab Church. They're a big church in Rocky Mount. I'm sure a lot of people have heard of them. They're like over there where Home Depot used to be at. They have a lot of space. We also have the Hope with the Hope program, which is an alternative learning system through Edgecombe County Public Schools. They're located in Tarboro. We also have Spade Middle School, which is in Wilson. And last but not least, we have Edgecombe County Courthouse, which is also big, like, wow. Edgecombe County Courthouse, as well as Graders Coming Ministries. They're joined together and they're coming also out of Tarboro. And we also have some of the team members on this meeting right now. They want to wave, they can say hi. But yes, they're here. So we're very excited, and you should be hearing more information really soon as the session goes on.
Thanks so much, Tyra. And then closing it out, here's our website. Thanks to Tyra's great leadership, ROI is on social media as of the last community meeting, so feel free to check us out on Facebook or Instagram. There is a block party in Tarboro this Saturday from 5 to 8 on April 24th between Main Street and Trade Street. And it's a part of the Unity and Equity event Together for Tarboro Coalition. So if you're free, it'll be socially distanced, masked, safe outside. There's an upcoming training, the Reconnect for Resilience training. There's an upcoming training that's free, usually costs $300 to attend the 14 hours, May 11th to the 14th. So feel free to hit the sign up link. And then if you ever would like any one of the certified trainers in our community to give a presentation, feel free to request it through a short form on our website. The link is also in the chat. And then the next community meeting like this one is going to be in July, late July, Tuesday, July 20th at 12 p.m. And please leave us some feedback. Couple quick questions. The link just got dropped in the chat. There'll be two winners who will win My Grandmother's Hands book or the Body Keeps scorebook, random draw for filling out the feedback survey. And if to close it out, if you'd like to share something you feel grateful for in the chat, or just any reflections or how you're feeling as the meeting closes out, feel free to. And then Chandra, if you want to close us out with a resilience tool.
Okay, no problem, Seth. I think before we go, Yolanda Thorne asked in the chat if we can put up the slide again one more time for the block party. She didn't get the details. There you go, Yolanda. And I expect you to pick me up if you're going. I'm going with you. I'm going with you.
Thank
Okay,
you
and
so
then-
much for putting that slide back up. I got it. Thank you.
Awesome. To close it out, I want to do one more rapid reset. I just want to say again, I'm so grateful to have been a part of this. This was a wonderful community meeting. I am grateful to have been here with all of you guys. And I think to close it out, just to reset our nervous systems and get set to go out there and take care of the rest of our day, I'm going to invite us to get up from our seats. We've been sitting for a while. So if you can find a place, a wall you can push, we're going to push against the wall. So if you cannot get up, that's fine too. You can push against your chair. So if you can put all your weight on your chair, that's the same thing. But if you can, I would invite you to get up and move to a wall. And you can put your hands on the wall and push forward. And if you're going to do it that way, I invite you to notice the temperature of the wall, notice the texture of the wall, notice your muscles as you push, like you're trying to push that wall down. The muscles in your arms and your shoulders, the muscles as you push that are activated in your legs, as you are pushing down into the ground for that leverage, activating those calf muscles, those leg muscles as we push. And if we need to do it from the back, you can turn around and use your back to push the wall and put your hands down and push that way. So either way, we're activating muscles, we're pushing our feet into the floor and paying attention to how that feels, the sensations in the body of pushing, muscles activated, temperature, really paying attention. And then as we release, we might want to shake that out. You can take a few seconds to push one more time if you need to, or if you're feeling like you need to stretch, just allow the body to do whatever the body needs to do. And as we come back to our seats, just kind of notice the sensations we feel. I know I feel relaxed, right? I felt those muscles tension up, but as we released, I felt like I wanted to shake it out, wanted to stretch. I see some folks stretching in there. Beachy got it going, shoulders moving. So I hope everyone felt a release there. Just really pay attention to your body because it speaks to us, right? It lets us know when it's tense and when we need to release. And we can use these tools at any time when we feel tension, stress, where we want to put our game, I'm going to say game face, game mind on, when we want to come into the room and be present. We can reset our nervous system so we can be present, we can work together, we can be creative, we can connect with each other, right? So I hope you guys have a beautiful, wonderful day. It was my pleasure to be here. I look forward to seeing you guys in the future. And that's it for me. Seth, Beachy, anything else?
That's it. Thanks so much, everybody. We'll send an email follow-up. Have a great day.
Awesome.
All right.
Bye.